given the paucity of evidence linking wildfire smoke to adverse human health outcomes, particularly in children. It is necessary to take into account the knowledge that can be gleaned from the reasonably sizable body of research linking health effects to specific air pollutants found in wildfire smoke outside of wildfire exposure periods. Given that chronic exposure to wildfire smoke has an impact on animals, people, and in particular children over the course of their lifetimes, and that wildfires themselves may exacerbate chronic exposures as they become more common, both the immediate and long-term effects of pollutants must be emphasized. Wildfire smoke composition and potential health effects of particular pollutant components. It is crucial to comprehend the elements that make up wildfire smoke and how they differ from and are similar to the elements of ambient pollution. It is known that gases like carbon dioxide, carbon monoxide, nitrogen oxides, and volatile organic compounds VOCs, such as formaldehyde and benzene, which contribute to particle concentration, make up the majority of wildfire emissions. Burning residential or commercial property may release additional toxic substances when flames reach the wildland-urban interface, though it is unclear how far they could travel, and they are probably only a local issue. Burning residential or commercial property may release additional toxic substances when flames reach the wildland-urban interface, though it is unclear how far they could travel, and they are probably only a local issue. It is important to remember that the composition of the smoke can vary depending on the efficiency, type of combustion, flaming and smoldering, and type of fuel being burned. Weather and meteorological conditions also have an impact on the compounds that escape the fire site, and as a result, the exposure levels of the nearby population. There may be a significant surface area available for other hazardous substances to adsorb on due to the abundance of high surface area particle matter in wildfire smoke. Although the primary components of wildfire smoke can react in the atmosphere to produce secondary increases in other chemicals, such as ozone and secondary organic aerosol, these secondary reactions can be more difficult to predict due to the variety of variables involved. Despite recent improvements, there is still room for improvement in our ability to replicate the characteristics of wildfire smoke. Direct inhalation of smoke can cause localized oxidative stress and inflammation, which can spread to the systemic circulation and have an impact on the respiratory system. Compared to other sources of concentration, wildfire concentrations inhaled directly into the lungs more severely trigger oxidative stress and an inflammatory response. Air pollution from wildfires is thought to be particularly more likely to cause oxidative stress than background pollution, because of the high concentration of polycyclic aromatic hydrocarbons, PAHs, and charged organic compounds produced during high-temperature burning. Particulate matter, which makes up a significant portion of wildfire smoke, has a higher percentage of ultrafine particles than typical ambient air pollution. It is well known that small particles, PM 2.5, those with a diameter of less than 2.5 m, settle deeper in the airways than larger ones, which increases the likelihood that they will harm the lungs. There is a significant risk of deposition deep in the respiratory system, because many of the created particles will be small, especially for children. Simulations of the deposition of wildfire particles support this pattern. According to the most recent EPA Integrated Science Assessment of Particulate Matter, children are more vulnerable to the effects of particle pollution. Particulate matter has a strong link to hospitalizations for respiratory failure and flare-ups of pediatric asthma. Additionally, there is some evidence that suggests traffic-related contaminants like particulate matter may play a role in the emergence of chronic respiratory diseases like asthma. Research from the past has also shown that raising children's exposure to particle matter, which is linked to worse lung function in children, while decreasing ambient levels of these pollutants from traffic, not only improves their lung function. This is crucial because adolescent and early adult lung health is a good predictor of future respiratory health. Our videos and shorts provide strong evidence that exposure to air pollution increases the risk of lower respiratory infections, with several pollutants, particularly linked to higher rates of pediatric pneumonia. Additionally, a growing body of research points to potential harm from particle exposure to children's cognitive development, including associations with ADHD, autism, academic performance, and memory. Ultrafine particles can pass the blood-brain barrier and enter the circulatory system, according to studies conducted on animals. Recent research has also shown that exposure to particulate matter may affect metabolism or growth. Adverse metabolic and growth impacts can manifest as reduced birth weight, slowed linear growth, and an increase in obesity, to name a few. Reliable data from population-based surveys on prenatal particulate matter exposure indicate that exposure to particles may have long-term effects on general health, even after taking into account a number of potential confounders. A population-based retrospective cohort study in China found that for every IQR increase in exposure to PM2.5 or PM10 during pregnancy, term baby's birth weight decreased by at least 3 g. These results are particularly concerning because early life exposure may act by programming basic metabolic, structural, and cell signaling mechanisms that may have lifelong effects. These detrimental growth and metabolic effects on children increase the risk of adult cardiovascular disease. Additionally, compared to ambient pollution, wildfire smoke has higher concentrations of PAHs and VOCs. Many of these, including benzene, formaldehyde, and benzo, pyrene, are recognized as carcinogens. Additionally, research has connected wheezing and exposure to VOCs. Given the frequency of wildfire exposures, these exposures may have significant effects on a person's lifetime risk of developing cancer. Consumer Trading Organization Limited will continue to evaluate policies, conduct research, and analyses to highlight realizable hosting and inform viewers.